Welcome back. Thom Hartmann here with you, and I'm really pleased to have in the studio with me Deborah Stokes, Dr. Deborah Stokes, PhD, LPC, BCN, licensed psychologist, licensed professional counselor, board certified in neurofeedback of the Better Brain Center here in Alexandria, Virginia, which does neurofeedback, which is a really cool way of kind of training your brain and learning how to regulate your own emotional states and all kinds of great stuff. Deborah, welcome to the program.
Thank you. Good
Great
to be
have
here.
you with us.
Thank you.
You and I were talking yesterday because I used to do neurofeedback on myself, or I used to actually go to feedback therapists, I guess is the word, also for just kind of de-stressing and help with sleep and all this kind of stuff. And so I was looking around DC for somebody who does that. But we had met years ago at one of these conferences when
when you did your show there.
Yeah, at Rob Call's conference. And so welcome to the program. You were telling me you're seeing that there's a difference between pre-election and post-election in your client behavior profile, people coming to the... Tell us about it.
Exactly. Well, I've been a therapist in the mental health field for about 34 years now, and I've been doing the neurofeedback for about 17 years. And we've seen lots of stressors that in the community that have had a local impact on our clients and sent a ripple of stress. One was the 2002 sniper that we had in Washington, and that really exacerbated a lot of our anxiety clients. And then we were hit with 9/11.
You can actually see this when you're doing neurofeedback. You're actually looking at people's brainwaves.
We look at biomarkers associated with stress or anxiety or sleeplessness, or we treat ADHD and hyperactivity, and they all have a signature. We also work with traumatic brain injury and headaches, migraine and tension headaches, and there are biomarkers associated with that. We specialize in the brainwave biofeedback, but we also do thermal, hand warming, sweat glands, breathing. And so when people are stressed, their breathing tends to be faster and more shallow. Their hands are cold and sweaty. So we do work with those biomarkers as well. But the anxiety clients were really affected by the sniper in 2002. The 9/11 affected all of us. It was more of a trauma, I think, for everyone in this area. And but now with the election, and I think it even started with this sort of vitriolic campaign, we started seeing it. And since the election, people are inundated with their stress. It's hard to get traction with teaching them self-regulation when the constant trickle of gasoline on the fire that we're trying to put out seems to re-trigger a lot of their stress responses.
Was it the election of Donald Trump himself that you saw the giant jump, or has it been since he became president and started this shock and awe campaign of something, 2-3 new things every day that
It's all of it. It started again with the campaign, and then it got worse with the election. And now one woman said it's like a gut punch every day. She's watching the TV, and what fresh hell can I be exposed to today? One client said. So we've seen, despite our best efforts, some people have had to resort to medication, or several of them have started or increased their dosage of medication. This would be an antidepressant. Yeah. Some of them with sleeping pills to help them sleep. We work with a little unit called the Alpha Stim, and we're going through those like hotcakes because that's something that people can use.
These are devices that are FDA approved.
They're fully FDA approved for sleep and depression and anxiety. So, but I think we work with a very vulnerable population. And again, we're mostly in a blue part of Virginia. So we don't see a lot of the Trump supporters. But I suppose if we did, they're pretty quiet about it. And I do know one, and she said she feels, and to be fair, she's very muzzled. She feels very muzzled in this blue surroundings where she can't talk freely about her feelings, and she's sick of being called a racist. So, it is on both sides. And but, I have older Jewish clients who feel very betrayed, very much a sense of history repeating itself, like we're returning to a fascist dictatorship, they're saying. And
they're seeking therapy for this.
And they're seeking therapy. We have also a therapy wing called Caring Consultants that we do a lot of psychotherapy. So we see about 80 people a week. So that's a large cross-section of people, again, and a mostly blue area. But, we've seen a lot of rage disorders. We work with conduct disorders. The kids are often affected by their parents. We've seen that a few times where they will start acting out because their parents are feeling very vulnerable. And I think the most vulnerable clients are our trauma population. Neurofeedback is indicated for trauma and PTSD. And these folks feel like this is another trauma.
Yeah, and it really is. I have a friend who doesn't live here in town, but who's a psychiatrist. You're a psychologist, you know, you're doing this, but he basically all he does is write prescriptions. And he's like, you know, since the election, the number of people coming in asking specifically for SSRIs, for Prozac, you know, for these anti-anxiety drugs, and benzos, has just exploded, and sleeping pills has just exploded. He's like, I can't take any new patients.
Yeah.
And so you're actually seeing your patient population increase along with the severity of the response of your existing patients.
Exactly. Exactly.
That's remarkable. So what can people do about this?
Well,
we have just a minute left.
Sure. I think if they can, people can stop exposing them to the chronic triggers of chronic outrage. I think if they can unplug, stop watching. I have several clients that's the only thing that helps them stop re-triggering these outrages. Go on a news fast, unplug. You know, neurofeedback is great for a lot of these stress responses.
Absolutely.
So, and learn to talk to one another. I think that having compassion for the other side and really looking into other people's. I mean, it's all born out of suffering on both sides.
And in fact, I mean, neurofeedback really got its big head start when Barry Sturman back in the 60s and 70s did that research where they, you know, it's awful what they did, but they injected poison into rats that damaged their brains, and then they put them on
cats.
Cats.
Yeah, monomethylhydrazine.
Yeah, and that's why he was so condemned for it. But he put them on neurofeedback, and the cats actually, their brains heal.
Yeah.
So and so this is no placebo effect. This is real stuff. Okay, this is
Thank you.
Deborah Stokes, licensed psychologist with the Better Brains Center in Alexandria, Virginia. The website is thebetterbraincenter.com if you want to check it out. Deborah, thank you so much.
Thank you, Tom. Great to be here.
Great talking with you. And thank you for being with us today. And don't forget, democracy is not a spectator sport. It requires all of us to participate. Get out there, get active, tag, you're it. We'll see you tomorrow.